Pay attention. This sign indicates cancer. In this video, I'm going to tell you 9 signs your body gives that could mean cancer. And it's very important that you know how to recognize them so you know how to act and also understand the seriousness of each sign your body is sending. So there are 9. What's the first sign you should watch out for? Pay close attention. And the first sign I set aside is for thyroid nodules, or some kind of mass in the thyroid, something you feel that's getting bigger. Why? Most thyroid cancers will appear starting from a nodule. So a nodule that grows in size. And this nodule should be investigated, so you can get an early diagnosis and know what it is. It's also worth mentioning that most thyroid nodules are benign, meaning they're nothing serious. However, yes, it is necessary to investigate because it could be a sign of thyroid cancer. I'm going to put a picture here so you can see what the thyroid looks like with a nodule. And I'll also put up a picture here of an enlarged thyroid. Why? Because many times when the thyroid starts to grow, a lot of people think it's a nodule that's getting bigger, but actually it's a diffuse enlargement of the thyroid, which can also mean hormonal disorders, for example. This also requires attention and can be just as serious because a thyroid hormone disorder increases the risk of a heart attack, for example, or a stroke. So it's also very serious. But since this video is about the signs of cancer, I'm going to highlight the thyroid nodule here. And what should you do after you suspect this? After you notice you have a nodule, or if the doctor feels it and sees that it could be a nodule? There are 2 steps here that are mandatory. And the first is to assess it with an imaging exam. Usually, the exam of choice is a thyroid ultrasound. In some places, it's called an echography, but it's the same thing. It's the same exam. And through this exam, we can find out the characteristics of this nodule. For example, if it's a well-defined nodule, if it has regular borders, if it's a nodule that has fluid inside, in that case it's actually a cyst, if it has microcalcifications, or if it's taller than it is wide. So these characteristics will help us determine the next steps. But I want to make it clear here that an imaging exam is necessary to evaluate this nodule. The second step, which is also very important, is a blood test to assess thyroid function. So through this, we can determine how the investigation will proceed. But for you watching this video, a thyroid nodule must be investigated. It must be evaluated. A biopsy doesn't necessarily have to be done. That will depend on the results, but you do need a doctor's evaluation because it could be cancer and it's very common. And the second sign your body might be sending, which could indicate cancer, is bleeding. I'm going to mention both extremes here, bleeding and also clots. You'll understand why in a moment. And why bleeding? For example, blood in your urine, blood in your stool, or coughing up blood, or maybe you cut yourself. And you notice that you're bleeding more than usual, that can also be a warning sign. Why? When you have cancer, the cancer can cause some blood vessels to rupture. This can lead to bleeding, like in the case of kidney cancer, which can cause blood in your urine, or bladder cancer, or even intestinal cancer, which can cause vomiting blood. So this rupture can happen, and it can cause bleeding. This part you probably already knew. But on the other end of the spectrum are clots, known as thrombosis. This sign is actually pretty interesting, and a lot of people are surprised by it. Usually these clots form in the lower limbs, in the legs, in the calves. And why could this have something to do with cancer? Because many types of cancer produce factors, procoagulant factors, meaning they increase your chances of developing clots. This can be very serious. Sometimes a person might have a type of cancer that isn't even that severe, but the consequence of that cancer is the formation of clots, which can be extremely dangerous because these clots can break loose, travel through the bloodstream, and end up in the lungs, causing a very serious complication called pulmonary embolism. It actually has a pretty high mortality rate too. So in a situation like this, It's a really delicate situation here. And I want to point out that when clots are present and the person doesn't have any obvious cause, like they haven't had surgery, haven't been immobilized, or anything like that, they're not in a situation that is known to increase the risk of clots, like pregnancy, for example. So there's no clear cause, you just can't pinpoint one. They haven't been in a cast, haven't been bedridden. Everything seems normal, apparently normal. And yet you have these clots. With this, which I mentioned about deep vein thrombosis, this is a warning sign. You need to investigate these other factors I'm mentioning here, because there could be a cancer affecting your blood clotting, putting you in a procoagulant state. This is also a very serious condition and needs to be treated. Both the underlying condition that's causing it and the consequence need to be addressed. Understood? Sign number 3, and this one is a very clear sign, is weight loss. And what kind of weight loss? It's 10% of your body weight in 6 months or less. That's a very significant time. Why? Many types of cancer can cause a loss of appetite. The person ends up eating less. Others may feel more nauseous, more fatigued. You'll end up having less desire to eat. And on the other hand, it can also increase your energy consumption. Some types stimulate energy consumption. And the result of that is that you'll lose weight, you'll shed pounds. So if you're losing weight and you don't know why, people will ask about that. So you need to investigate whether it could be cancer. Other diseases that should also be investigated, there are 3 I want to highlight here, okay? Diabetes, you need to check blood sugar levels because it can, in fact, cause weight loss, especially when those levels are very high. It can lead to a state of weight loss. Did you know that? And also thyroid disorders. Here, I want to highlight hyperthyroidism. When the thyroid produces too many hormones, that can also cause weight loss. Oh, but I heard that's a myth, that the thyroid doesn't make you lose or gain weight. I don't know why there's so much information like that on the internet, but yes, the thyroid can make you lose weight, and not just a little. It can cause a lot of weight loss. Sometimes 20% of your body weight, 25% of your body weight. It's a very noticeable weight loss. Why? With increased production of thyroid hormones, your metabolic rate goes up, and there are all sorts of changes in your body. And yes, it can cause weight loss. It's a causal factor, and the weight loss can be quite pronounced. So you also need to check your thyroid hormones. And another issue here is the matter of parasites. You ask me, oh, but why not? Why don't you talk about parasites on the channel? Actually, I do talk about it quite a bit. Here's an example, because it's extremely common, okay? Parasites can also cause weight loss and changes in appetite. These are 3 extremely common conditions, but cancer should also be investigated, especially if these other causes are ruled out. All right? There are many cases where weight loss is a very prominent sign, so yes, it does need to be investigated. Sign number 4, and this one, also extremely common, but less specific, is fatigue. That change in energy, you wake up already tired, your physical fitness goes down. Why is that? Many types of cancer can cause anemia. What does that mean? It's a reduction in the red blood cells in our body. And anemia can cause the symptoms I'm mentioning here. So fatigue, hair loss, paleness, weak nails, difficulty breathing, what's called shortness of breath. So you need to continue this investigation by doing a test called a complete blood count, which will show the count of these cells. And from there, we can get a clue about the possible cause. Because the person might be bleeding, for example. You could be bleeding and not even know it. Bloody stools, or the stool is darker and the person didn't even notice. Or sometimes there's bleeding that goes unnoticed, and the person can't identify it. And through this test, the complete blood count, we can find out the red blood cell count, and then by analyzing it, check if it could be cancer that's causing this. Another very important factor in this test is the evaluation of white blood cells, leukocytes, and also platelets. Some changes come together. And another key point in this test, you often ask me, right? What are those letters? You've probably already noticed or looked at them. The blood count test has several abbreviations there. One of those abbreviations is MCV, which stands for mean corpuscular volume. What does that mean? It's the size of the red blood cell. And by looking at the size, we can get some clues about what might be causing it. For example, if there's a change in folic acid or B12, it can lead to large red blood cells. If there's a change in iron, iron deficiency can lead to small red blood cells, which is called microcytosis. So, through this analysis, we can get a clue about what might be causing it, or if it could be a cancer that's affecting production of the red blood cells, or maybe it's causing bleeding, as I explained, okay? So, fatigue. If you have any of these symptoms I mentioned, you need to get tests done as well. And what about sign number 5? I want to highlight that skin cancer, a specific type called melanoma, which is also a common cancer. And how should you evaluate this? How should you be suspicious? What's important for you watching to know? I'm going to put a picture here, and through that picture, I'm going to give you some characteristics that are warning signs of skin cancer. You can see that I've included several types. They all refer to this type of cancer, which is called melanoma, and they have characteristics in common. For example, they are freckles that are asymmetrical. If you divide it in half and compare the two sides, you'll see that it doesn't have a perfectly even proportion, like benign nerves. You can also see here that they have more than one color. Another very important characteristic is that the edges are irregular. It's not perfectly round and cute there, that little spot. No, they have irregular edges. Another sign can be raised spots that bleed or that itch. Another sign is a larger size. Or something I want to highlight here and want you to know are those spots, those moles that keep getting bigger. It's easier to identify. You can notice it, and then yes, you can seek help. It's worth mentioning here that this initial evaluation to see whether it's skin cancer or not can also be done by a general practitioner. When I worked in primary care as a general practitioner, I used to do this evaluation, and many patients were surprised. Oh, why are you doing this? You're not a dermatologist. And I always explain, I'm not a dermatologist, but I can evaluate these signs. It's really simple. And through this, it's possible to refer the patient to a specialist, have the lesion removed, and send it for lab analysis to find out what it is, to see whether it's cancer or not. You can see that this analysis, this evaluation, it's really simple to do. You just need to have this knowledge, okay? So pay close attention to moles that get bigger or have any of the signs and symptoms I mentioned here. This is a major warning sign, and this type is very aggressive. If it's not diagnosed early, your chances drop a lot. And in the beginning, right when it starts to spread, that's when you really have. Your chances are much higher, okay? So it's really worth paying attention to this. Sign number 6. And this one is a sign of colon cancer or colorectal cancer, which is a change in bowel habits. A lot of people think it's just diarrhea, but that's not the case. Constipation can also be a sign of colon cancer. So it will often fluctuate between diarrhea, then constipation, then diarrhea again, or sometimes just diarrhea or just constipation, but it's a change in your usual pattern. If you haven't started exercising, haven't changed the fiber in your diet, and now you're experiencing a change or alternating, hey, that's a warning sign for colon cancer. Also, bleeding in the stool, so darker stools, thin stools. You go to the bathroom and it feels like you can't completely evacuate, that's called tenesmus. This can also be a sign. Abdominal pain, usually cramping pain. So these signs and symptoms require investigation. You might be dealing with it. With colon cancer, colorectal cancer. And how is this evaluation done? If there's suspicion, you need to see a doctor to get a colonoscopy. Is it no use? Trying to do other tests if you suspect colon cancer won't help. Well, for example, the fecal occult blood test. A lot of people are afraid to get a colonoscopy, so they want to do the fecal occult blood test instead. But in this situation, that test isn't useful. Why? There are many types that don't bleed. Other types have intermittent bleeding. In other words, it might bleed a little, then stop, then bleed again, and then stop again. And sometimes you end up taking the test right when it's in the phase where the bleeding has stopped. Or sometimes it doesn't bleed at all, so the result comes back negative, which can confuse you and delay the diagnosis. you'll be left with the false impression that everything is fine, when in reality, it's actually cancer. So, the first lesson here is about something you shouldn't do: fecal occult blood test. If you suspect cancer, you need to go straight to a colonoscopy. In recent days, in the past few weeks, you all have been asking a lot about another test, which is a blood test that can assess your risk of cancer from your gut microbiota, whether you have dysbiosis or not, or eubiosis. This test is still in the trial phase, okay? It's not useful in this case. Let's not try alternative tests that will only delay your diagnosis. The same goes for carcinoembryonic antigen, or CEA, the tumor marker. This test here isn't useful for diagnosis, but rather for follow-up. For example, you were diagnosed with colon cancer, had surgery, and then you can monitor with this test I mentioned, but it's not useful for diagnosis. There are a lot of false positives. Just in this number here, in this sign, there are already several tips. If you learned something, don't forget to like the video and subscribe to the channel. Or don't forget to turn on the notification bell. Let's keep going. And sign number 7 is the swelling of lymph nodes. Those little lumps that get bigger when you have an infection. A cold, for example. You've had a cold. I'm sure you've noticed that in your throat or neck area, those little lumps get bigger. Those are lymph nodes. They are part of our defense system. Tonsillitis, for example, can make the lymph nodes swell. But why can this be a sign of cancer? When you don't have any infection at the moment, and you notice these lumps are swollen, your lymph nodes are enlarged, you need to investigate why this is happening, because it's not normal. It could be a sign of cancer. There is a type of cancer of the lymphatic system, and other nearby cancers can also cause these lumps to become inflamed. They can send metastases, as we call them, cells to these lumps, and they get bigger. So enlarged lymph nodes can mean cancer, and a medical evaluation is also necessary. Deal? Number 8 is progressive pain. And this is also a sign that often gets overlooked. For example, a headache. But it's not just any headache. It's the kind of headache that keeps getting worse. In other words, it's progressive. You need to take more and more medication. You're increasing the dosage and it's not working. The pain is getting worse. Whoa, that's a warning sign that it could be cancer. The same goes for pain in another area, like abdominal pain. If there's no apparent cause and you have stomach pain, and that pain is getting worse, and you're taking more and more medication, hey, that could be a warning sign for cancer. Well, it's not worth waiting any longer or letting it get even worse. Why? As he saw, the earlier it's caught, the better your chances, right? So progressive pain, the kind that keeps getting worse. And the sign? Number 9, another one that's often ignored, is an increase in body temperature. There's fever, which is an increase in body temperature due to an infection, like the flu, for example, or some other infection. And then there's hyperthermia, which is an increase in body temperature without an infectious cause. And here, I want to highlight that kind of temperature increase that it happens in the evening and at night, before going to bed, and it can be accompanied by night sweats. Sometimes you even have to change the bed sheets, right? You have to change the pillowcase because your body temperature is higher, which can also cause sweating. This sign is never normal. If your temperature is going up, you also need to investigate whether this is due to some illness, and one of those illnesses could be cancer, okay? So make a note of this sign here. Many times it gets overlooked during a medical evaluation because when the person wakes up, they tend to feel better, and then at night it gets worse again. On a scale from 0 to 10, what score would you give this content? If it's a 10, I'll make more videos like this one. Now I'm going to leave a suggestion for you to watch. It's a video where I talked about 7 habits that can help prevent a stroke. Did you know that? That a stroke, in many cases, can be prevented. If you click here, you'll find out what those habits are that lower your risk of having a stroke. Take care, see you next time.